So this session is creating consensus for the protection of children's environmental health. And I'm just so happy that Elise is here because she has a lot of experience over many, many years in working across many different disciplines in creating consensus and consensus statements. And please read her bio, and I hope that she'll share more about her work. I'm just going to be very brief to say that she's the National Director of the Collaborative on Health and the Environment. And we are so grateful for the National CHE and all that they offer, the working groups, the resources, all of the information, the scientific information, the opportunity to have civil dialogue through the partnership calls. All of it is just a wonderful resource that I hope you all will take advantage of. And we are, again, fortunate to have a regional partnership with CHE here in Alaska, and we have monthly Collaborative on Health and the Environment partnership calls, and we hope that those would be of interest to you. And if you have a topic or anything that you'd like to offer, please let us know. So I'd like to welcome Elise.
What a privilege to be here. It's truly humbling after hearing so many of the stories of the last day or two of those most impacted. And so to stand on this stage here and to address you all is really, really a privilege for me. And I'm so grateful to Pam Miller, who I wish was actually a relative of mine. Unfortunately, we're not related. There was kind of a Miller in every town. So we aren't related, and I grew up in the very southwestern corner of Virginia in coal mining country, so that was probably a fur piece from where you grew up. But in any case, ACAT staff and ACAT itself, as you all know, is just one of the more powerful groups working on every single level, whether it's a local, state, obviously, as well as national and international levels on these issues. And you all are really lucky to have ACAT here in Alaska. So I was thinking right now, and I'm sort of so satiated with both emotion and information. And I realized what Kathy was doing with the Mobius Strip, and I have an 11-year-old, and so we've done the Mobius Strip and made all the different parts of it and cut it in half and all, but how she did that, and I realized this conference is really an expression of the Mobius Strip, because I feel like we've been weaving in and out of both the kind of cerebral, the science and the data and all that, and then these incredible stories that really are the power that feed, and inspire us to do what we do. So it's kind of like we've been switching back and forth, and sometimes that's a little challenging too. I mean, part of me is still back in, 7 generations experience. So I'll just say that for now. So I wanted to talk about the Collaborative for Health and the Environment. And make sure I can, there we go. And we started in 2002, and really our theory of change, I'll say, is that if we got together people who had been impacted by the environment, who had various diseases and disabilities where environment played a role, if they knew about the science that was, that continues to emerge, but if they knew about that science, were able to feel confident in speaking about that science, then they would have a very strong voice in helping policymakers and others to make better decisions around children's environmental health and health across the lifespan, really. And so we gathered together people who were working with those with childhood leukemia or brain tumors, endometriosis, other reproductive health issues, learning and developmental disabilities, all of these folks to say, well, here's the state of the science, and here's what your constituencies, might want to know about, and how can we help you? So that's really how CHE got started. We also, the top quotation says, pollution kills almost 3 times more people than HIV, malaria, and tuberculosis combined. And I often put this statement up. It came from data from the World Health Organization, And it just puts in perspective, of course, it is so important to focus on infectious disease, and you know, it's going to be happening more and more with Zika and other viruses. But if we could just invest as much in reducing pollution, and just think about the kind of world we would have if that were, you know, that was equally as important, and that's what I hope to press for. So CHE now has, let me make sure I push the right button, about 5,000 partners in 87 countries, all 50 states and the District of Columbia. And we are trying to create this vibrant learning community. So I had one partner tell me, Elise, you all are kind of like the NPR of the environmental health field. And I thought, well, National Public Radio, I kind of like that. I listen to them every day, and I appreciate getting those resources. And in a way, that is what we try to do. We try to bring the best available science and analyze it in ways that are accessible, have conversations with cutting-edge researchers about the science, what the implications are, what are solutions, and so we try to create that kind of ongoing source that people can turn to, and so I know that's still a little high, but that's all right. So we offer all these different forms, and there's the working groups. We have 20 plus working groups on everything from learning and developmental disabilities, to breast cancer, to Parkinson's and various neurodegenerative diseases. So it's really across the spectrum. And we also focus on the chemical exposure aspect, but, and a number of people have brought this up over the last day and a half, there are all these other what we call environmental factors, you might also call them social determinants of health, that influence our health across the lifespan. This is supposed to be in color. Actually, you're getting a preview of our new graphic that will be on our new website in about next month. There'll be announcements. But what we're saying here is, though we privilege some of the work that we're doing on the chemical environment, there's the technological environment, and in that we include radiation and other exposures. There's a built environment, there's the food and agriculture environment, and of course there's a socioeconomic environment, the psychosocial environment, and then there's climate change and these other issues, and they all impact us in lots of different ways, and sometimes it's hard to tease apart all these factors that are constantly impacting who we are and who we're becoming. But it's important that where the scientific literature leads us, where they have information about, things, the nexus of exposure to chemicals and coming from impoverished backgrounds, and coming with the ACE studies that people were referring to, the adverse childhood effects, coming from abusive homes, and like all those come together and condition us and impact how our life trajectory. So the result of a lot of the conference calls we do, and we actually do up to 5 every month on hot research topics with some of the best researchers and some of the other advocates doing incredible work in the world. And over the last 5 years, our calls have been downloaded over 300,000 times, which says there's a lot of need for this kind of information. And along with getting that information out, we've seen some real results. And one of the things we've done is to help convene groups, scientists from different disciplines, around creating consensus statements to use this to leverage policymakers. And we've done that with reproductive health. We've done that with Parkinson's disease, and we've done it with learning and developmental disabilities. So these have been utilized, and now the new tender statement, Maureen isn't here, is going to be using that same way to, here's the science, we know it, we can act now. And so the result of one of our scientific consensus statement on reproductive health and the environment was the creation and establishment of the very first program in a major university, the University of California, San Francisco, where there's a program on reproductive health and the environment that didn't exist in the United States before. And they're doing incredible work, and there's replicating those kinds of academic programs elsewhere. We also worked very closely when the President's Cancer Panel finally decided to focus on environmental contributors to cancer, and we helped bring that information. We provided expert testimony, a number of our partners, and that resulted in a very hard-hitting report from the President's Cancer Panel. Of course, it hasn't been listened to in the way it needs to, saying we are doing grievous harm to the American public by not focusing on the environmental contributors to cancer. We also worked for years with various national learning and developmental disabilities organizations. Maureen Swanson is one of them, and they are carrying on this work, being influential in making policies and market changes. We've published over 60 articles and papers and fact sheets and so forth for people to better understand it, have that information at their fingertips and use it for prevention-oriented actions. And most recently, we published this multimedia ebook, and it's called A Story of Health. And basically, we have tried to take the science as much as we can combine it on all these different health contributors or environmental contributors, including chemicals, but also looking at socioeconomic issues and other factors. And we have based it on a family reunion. So there's kind of like Aunt Betsy, who has breast cancer, and Joey, who has a learning disability, and someone else with Alzheimer's, and so on and so on. So we have 3 case studies that are out, and basically they're fictional characters, but given a realistic story. And the case studies that we have out are on asthma and learning disabilities and childhood leukemia. And these are readily available. They are also, we got an award in excellence in communication from the CDC this year for Story of Health, and this is now being, it's hosted on the CDC website, and anyone can get, well, health professionals primarily would go do this, but get CE credits for taking this course. In a few months, we'll have our next case study out on reproductive health and the environment. So I'm sure if you're in touch with ACAT, you'll get our announcements about that. But so we've done all this collaboration and consensus building, but there's so many layers and levels to it, and I feel like this conference has embodied and expressed so many of the questions I think that underlie how do we do collaboration well? How do we build the relationships? And it's just what Kathy and Lisa and others have talked about. It's really about relationships, right? This is what we have to do. We have to do it well in order to move forward. So I'm going to tell you a short story first, an historical story about how, in my experience coming into the environmental health field almost 25 years ago, and first as a founding director of a small private foundation, and then working with, I founded another organization I'll talk about in a second. But I was, as a foundation director, we were seeing all these projects going on in children's environmental health, and it was exciting. It was a new budding field. This was 1993, and a lot of new organizations were emerging, and so it seemed to me, being able to read all these project proposals and all, that there was still a gap, and people were doing amazing work on the policy level and talking about children's susceptibilities, and they were working, spearheading scientific research studies and working on greater corporate responsibility and safer alternatives and all of this. That there was no coordinated effort. There was no consensus statement or kind of guiding principles about why we're doing this and why we need to do this collectively. And so I got this bee in my bonnet or whatever, and I really wanted to change that. And so with that vision in mind, I founded the Institute for Children's Environmental Health, National Institute for Children's Environmental Health, in 1999. And given I was the new kid on the block, I actually partnered with what was then the Children's Health Environmental Coalition, now that, it was then named the Healthy Child, Healthy World, which is now merged with Environmental Working Group. But at that point, it was called CHECK, and we decided to put on a Children's Environmental Health Summit in 1999 outside of New York City. And Ruth Etzel was there, and Phil Landergan, and a number of other luminaries in the field who helped us organize this as well. And 25 key leaders, and it was a really pretty small field at the time. The kind of running joke was that we shouldn't all get on the same plane at the same time because if it went down, like the whole field might disappear, which fortunately did not happen. But it was just, there was just 25 of us, and I think Charlotte was there. Where's Charlotte? Anyway, there she is. What's that? Yeah, okay. And there were two things that we decided we would do at that particular summit, and that was to create a set of guiding principles. People from government and academia and advocacy, citizen community organizations coming together and saying, what can we say jointly about the field? And we also, it seemed like we needed some kind of partnership because though there were these great individual organizations doing their work, there were still turf battles, which happens in every sector, but, I'm working on this and you're working on that, but, we're all working towards the same goal, protecting children's environmental health. So finally, in December of 1999, after sort of 3 excruciating weeks of calls that I facilitated wordsmithing this document, we all signed on, and it was approved collectively. And it says a lot of the same things, sadly, that we're still working on today, 17 years later. But it basically named what the American Academy of Pediatrics and the National Academy of Sciences was saying about children's being uniquely susceptible. And then we went on to just talk about what children's rights should be and how we need to protect them. All children have the right to clean air, safe food and drinking water, consumer and commercial products free of environmental health and safety threats. All children have the right to healthy homes, healthy childcare facilities, healthy schools, and healthy communities. All children and adults have the right to know about proven and potential hazards to their environmental health and safety. And it's our mutual responsibility to protect these rights and to act with precaution on decisions that could affect children's health and development. And I wish I could say we had come leap years from that 17 years ago. And this is still what we're working on. And that's okay, because we have had some wins, and there's some incredible work going on still, but we can do even better. And that's why I'm so grateful that, having another summit, we need more of these. We need more of these conversations, and there's never just one. It's an ongoing process that we need to commit to, and everyone else in this room, I think, has really made that commitment. And then with the Partnership for Children's Health and the Environment, I kind of created a logo that had different people's logos in it. So again, this wasn't one organization. This was the partnership in the field. And so that was, we mapped out the field, looking at who was doing research and place-based work and policy, and working with different constituencies like pediatricians or nurses and so forth. And we just kind of mapped it out on which organizations were doing what. And again, it was a much, much smaller field at the time. And some organizations like Children's Environmental Health Network were doing several of these things, of course. But it was a very exciting time. We had several years of meeting together, discussing our projects, coming up with other strategies. And I think, took us to another level, right? And the partnership doesn't exist in this form anymore. Like with many things, you have to be able to know when to let go, too, and say, well, now that so much is burgeoning, there's so many other organizations, dozens and dozens and more doing this work, we don't need to do this particular piece anymore. And it's being carried on in other ways. So we let go of that piece, but it's really being embodied in all of the work that's going on today. In reflecting on this and the many other collaborative and consensus building processes I've been involved with, and I know most of you all have been involved in many as well over the time. There's a few core principles that I just thought I'd share. Many of you all could probably share these or others. And in many ways, they were embodied in what Kathy and Lisa talked about, and these in respect and listening and looking both back and forward. And so this slide, of course, I thought might appeal to Alaskans. We don't want to do as much butting heads, and we like to do more of the kind of handing off and that kind of teamwork where we're kind of building towards something collectively and as equals. And so I just thought I'd share these few pieces. Again, I feel like these have all been said, in other ways, in very powerful ways earlier in this conference, but I just want to talk about a few of them. And if I could find my notes here, it would be helpful. So I'm going to take a second. So when I first embarked on all of the work of environmental health, I basically did this by intuition and empathy and just trying to listen. But there's some great ways of framing what we all know is true, and I just find it helpful to reiterate them. So the goal is reciprocity and equity. It's not charity. And so if the work is truly reciprocal, meaning that both parties, all parties are feeling helped, and there's a sense of equality in that, then it's not charity. Charity is about me helping you, and it's often fraught with overtones of power and privilege, as we've heard so much today. Each field of endeavor has this element of philosophy of charity, and it comes across as I want to help you, but it actually sort of says, well, I know better than you, and that infuses any kind of relationship with a power differential and a judgment. Lillian Watson, who an incredible Australian Aboriginal woman who's a visual artist as well as an academician, and she said, I thought she captured it beautifully when she said, if you are here to help me, you are wasting your time. But if you are here because your liberation is bound in my liberation, then we have work to do together. And I feel like that has been said in so many ways on this stage already, but it's really, it's so much more important. And what are the ulterior motives for wanting this kind of collaboration? Is it charity or is it reciprocity? So, and these other parts have been talked about before, but it's, I often want to go, okay, so we're going to all get together, we're going to do this, and it's going to be great. And it's like, no, whoa. We got to step back, and people have said this. We got to begin by revealing and honoring our differences, not just looking at our similarities. It's so easy to go we're all one. And actually, a friend of mine who's done a lot of work in various communities where there's been tension over decades or hundreds of years, and he said, this one friend came up to him and said, what was it? He said, he said, he's a black man, and he said, every time I hear a white guy talk about oneness, I don't feel seen. And I think that this is just a really key piece. Again, other people on the stage have already said this more beautifully than I, but it's just, we can't go right there. We have a vision, a goal together, but we want to understand our histories, our differences, where we came from, how we got here, what's important to us, what do we need to prioritize. And so I think that piece also leads into the next piece about learning the history, this exercise with the ancestors. Learning, makes me want to understand my history better, because I can't speak in that same way about my history. And it's so crucial, and it's certainly crucial to the impacted communities like the ones here in Alaska. And to listen to those histories and to make time for those histories is just essential to any kind of consensus or collaboration. Finally, there's lots more I could say, but I want to keep this as short as possible. But, and this kind of, again, sums it up. We need to bring together the most affected, which Pam and others in ACAD have done. with those of us who happen to be most connected. I've been fortunate that I have been able to travel around the world, go to DC, make talks and speeches, and work with different populations. But before we start anything, we need to create these clear agreements about what we want to do together, and that everyone has buy-in. Everyone from the get-go says, okay, this is what we're going to be doing together. And you keep revisiting those agreements. Things will evolve. You need to keep checking back in. And that needs to be the process. And I really feel this conference is already well on its way to again, to embodying these kinds of principles. And I have every expectation that we will come out of here with some action items that we can all participate in manifesting. So thank you so much for your time. One last slide. This is my son, and this is just before I left, and he's gotten a new bunny. And, someone said, Gina McCarthy says, not just about the bunnies, it's about the children. So I figured I'd throw this slide in. And there's our cat in the background, which we took about a week to convince that we did not bring this bunny home for dinner. Because he thought, wow, this is just so great, they brought dinner home. But anyway, you could tell they've made friends. So, all right, thank you again.
Thank you, Elise. As we go forward, I just want to share that in Annie Aloha's words, not to point fingers, but work together to help communities like mine and others that are facing similar issues. It's not about, like Elise mentioned, it's not about who knows more, or the inequity in power or resource. Sometimes there's lack of resources. However, if we work together for the same goals to protect our children's health, look at the exposures, the possible exposures our children are facing. Whether it's in our homes. I had no idea that my couch had flame retardants in it. And I, as a mother of 4 boys, 5 counting my husband, and 2 beautiful granddaughters, there was a time I never thought I could have children. So in our culture, we honor our elders and our children, and we need to find a way to help each other. We need allies in the healthcare system, in the regulatory agencies, in state agencies, Department of Health and Human Services, and in all people from all backgrounds, and learn to find a way to work with our tribal leaders. And a lot of times when we meet with federal agencies, we bring our tribal presidents and leaders to the table, but they don't bring their decision makers. We need to work together so that our health are protected, so that we're not exposed to begin with from toxic chemicals that are in our homes, in our environment, especially in our schools and playgrounds, and but also in our foods. I had no idea how food containers had contaminants in them to protect them from cartons to protect the food in it. I don't recall the contaminant in them. However, those are things that I'm coming to learn. I was a stay-at-home mom for 6 years, and I had no idea of any exposures that, I have in my home. That baby shampoo has formaldehyde, that your toothpaste has triclosan, and these are chemicals I've never heard before. But we bring them in our homes, and we need to find a way to hold the manufacturers accountable, there needs to be systemic change. And I think as we go forward to work with open minds, and because our children are our future. And thank you.